viral hepatitis. So when we say hepatitis, we mean an inflammation of the liver caused by viral infection. Sorry, an inflammation of the liver caused by viral infection. And this hepatitis ranges from inflammations to fibrosis. That is when the liver inflamed. It now lead to what is called fibrosis. That is the scarring of the liver. And when it's not treated, it now moves to another stage called cirrhosis. Then from cirrhosis to cancer, it undergoes 4 stages now: inflammatory stage, fibrotic stage, cirrhotic stage, and cancerous stage. So these are the stages in which livers undergoes, and it's caused by viral hepatitis or viral infection. Basically, we have 5 types of viral hepatitis. Of the 5, we have hepatitis A, caused by hepatitis A virus. We have hepatitis B, caused by hepatitis B virus. We have hepatitis C, caused by hepatitis C virus. We have D and E, all of them caused by their respective virus. So hepatitis E and hepatitis E, they are kind of hepatitis that are caused by injection of food or contaminated water. So hepatitis B, hepatitis A and D, hepatitis A and E, they are caused by injection of water or contaminated water and contaminated food, and they can be easily treated or prevented by taking vaccines and treated by taking the appropriate medications. But hepatitis B and C, they are of medical importance because they can cause a lot of harm to body system, and it can lead to death. The scope of death of hepatitis B and C is much compared to hepatitis B, hepatitis A and D, hepatitis A and E. So that was why we consider hepatitis B and hepatitis C as of importance to medical or to medicine. Then what are the ways in which one can contract hepatitis B? Hepatitis B mostly contracted via blood-bound or body fluids. Let's say, for example, during transmissions and transfusion of blood. That was why it's very good and necessary for any persons that requires blood should be done in the hospital, because most of the hospital we have machines that can detect a virus even at the incubating period, both hepatitis virus and HIV virus, even at the incubating period. So it's good to be having transfusion in the hospital, well-established facility. It's going to be administered by well-trained personnel, either doctor or nurses. Because in other village and on other community, you will see people have been transfused without proper screening. I don't know whether that blood is incubating is in the incubating periods. I cannot show at that point. So it's better and it's advisable to not to transfuse in a local way. Please, if somebody requires transfusion, refer that person to the appropriate facility, which is going to carry out by a trained personnel. So, and as we said, hepatitis B can be transmitted via blood fluid, like during sex. One can contract if your partner has hepatitis be likelihood for you to contract it, because it can be easily penetrate the body and the semen, and one can also contract it during medical procedure and surgical procedure if the instrument used they are not well sterilized because of one thing or the other. One can also contract it if the injections used there's a share injections. One can also easily to get contracted, and people that get marks like ours one can also easily contract it, because olden days when we have been marked, there are no sterilization methods. So you all these traditional castrations. So you castrate this one and also you castrate another one. So there's no proper sterilization. So these are ways in which one can contract hepatitis unknowingly or during surgical procedure, I'm going to say. Then coming to C, hepatitis C, the mode of transmission of hepatitis is almost the same thing with that of hepatitis B. Just a slight difference there is, we said hepatitis B, one can contract it when during sex, but that of hepatitis C, there will be the likelihood of contracting hepatitis C is minimal. So that is a slight difference there, but other blood-bound medical and surgical procedure, one can contract hepatitis B. So these are ways one can contract hepatitis C and hepatitis B. Then hepatitis D. Hepatitis B, one can contract hepatitis B when you are already infected with hepatitis B. So hepatitis D can only set off when there is hepatitis D. I want to welcome you to my life. Please, you can drop a comment, you can drop a like, and you can share the video. It has gone out. So one can contract hepatitis C and hepatitis D, so to say, when you have already contracted with hepatitis D or hepatitis B. So hepatitis C can only set off, hepatitis D can only set off when somebody is contracted or is being infected with hepatitis D or hepatitis B. So at that point, you find out that the person with condition there is somehow dangerous. The condition is somehow dangerous. And then, I don't want this video to be too long, but before I just go off out of the live, I just want to, within 10-15 minutes will be okay. Before I sign off, I will leave you with how can you prevent yourself now? Once you are negative, please go and take vaccines. No matter what the situation, go and take vaccines. No matter what it's gonna cost you, go and take vaccines. No matter the distance, go and take vaccines. Because hepatitis, it's not easy to be managed. It's not easy, especially when it becomes chronic. When the signs and symptoms started developing, it's not easy. You are going to be on drug for life, especially hepatitis B. But that of C, it can be cured. But that of B, it cannot. One has to live with hepatitis B for life. So Once you are negative of hepatitis B, go and take vaccines. Go along with your household, test them. Whoever is negative, enroll him for vaccinations. And unfortunately, if any one of you is positive, then immediately commence the treatment. But you should not commence the treatment, safe treatment. You should go to your doctor. Your doctor will prescribe some certain tests for you. After the tests, when the doctors sees that you can take drug, you can start taking drug, you can place you on drug. But it's not immediately that you can start taking drug. But what I'm saying, you should start treatment immediately, because you have to enroll, you have to go on investigation, and the doctor will start monitoring your viral load. This is Hadi. I'm a nurse by profession and a health promoter. If you enjoyed this video, please just like the video, share it to groups, and leave a nice comment, because that can ginger us to bring you more and more videos which is going to change our life positively. I may be the one to change your life today, or you can be somebody that can change somebody's life via this video by just sharing. Thank you for watching. Bye.